The number one message that we always give is never use alone. That's the number one harm reduction strategy. If they hear nothing else, never use alone, because when you use alone, there's no one there to respond in case you overdose.
For a New York State employee to be speaking this freely and openly about how individuals should approach their drug use is a testament to a changing tide. But for Mary Brewster, New York's newly appointed Associate Commissioner for Harm Reduction, such a frank and honest conversation is long overdue.
We know that people will always use drugs. And so if we know that people are always going to use drugs, how do we get them to use drugs as safely as possible? And recognizing that every single life has value and we should do everything we can to save that life.
As part of her position, the very first of its kind in New York, Brewster will spend much of the next year visiting rehabilitation centers across the state, helping facilities like this one with their naloxone distribution, fentanyl testing, and needle exchange efforts. Today, she's meeting with Twin County Recovery Services in Hudson, New York.
Making sure all of the moms have naloxone and know how to use it and have these conversations with their kids that they know are using opioids of, if you're going to use, let me know so that I can be ready with naloxone in case.
Born during the early days of the HIV/AIDS epidemic, harm reduction played a crucial role in the dramatic reduction in HIV infections amongst intravenous drug users. As HIV spread through this community, activists in some major cities launched clean needle campaigns. In San Francisco, the city's AIDS Foundation even created a mascot, Bleach Man.
Cleaning needles is easy. It won't hurt the rig, and it kills the AIDS virus. Here's how.
While harm reduction has been used for decades, the term has never been used as part of any federal response. But for the first time, the Biden administration included the term harm reduction in last year's federal budget. The inclusion comes as research continues to point to the efficacy of the approach. Nearly 30 years of research show that users of syringe service programs, or SSPs, are 5 times more likely to enter drug treatment and about 3 times more likely to stop using drugs than those who don't use SSPs.
How important was it to have the Biden administration use the term harm reduction?
Huge. It was huge for the federal government to, one, say the word and then to fund it.
As part of the $42.5 billion budget for the National Drug Control Agencies, the budget earmarked millions of dollars to improve access to naloxone, build needle exchange programs, and distribute fentanyl test strips across the United States.
To those still struggling, I want you to know that I see you.
We need to do everything we can to really help keep people alive.
Dr. Chinazo Cunningham was appointed Commissioner of New York's Office of Addiction Services and Supports, or OASAS, by Governor Hochul last January.
You've been in this position for about a year. Where would you say things are in New York in terms of what you hope to achieve?
We are in the worst, overdose epidemic ever on record. In New York State, 16 people die every day of overdose. So, this is involving mothers, fathers, children, aunts, uncles, cousins, neighbors, coworkers. There's no place that this doesn't touch. And I think that there's no family or individual that this doesn't touch.
While Cunningham has been working in addiction services for decades, she says the official adoption of harm reduction strategies is substantial.
There's a ton of evidence, decades of evidence across the world that shows that harm reduction efforts are really effective. And so this is also, using a data-driven approach and evidence-based strategies is absolutely what we need to be doing. This is a medical condition. We need science to help guide our work. This is not about, morality and weakness or strength. It's about a medical condition. So we need to, approach it in that way.
What's a greater challenge, working with the community of users or working with the community of non-users as it relates to understanding and accepting harm reduction as a policy?
We all grew up hearing the same messages in this country. So doctors, lay people, and people who use drugs, right? And those messages were, just say no, and it's, this is your brain on drugs, which frankly are harmful. And so I think across the board, it's a little bit of unlearning what those earlier messages conveyed.
I got this tattoo before I got the job, but I literally have a tattoo that says any positive change. It's my harm reduction tattoo. Awesome. So,
when you look at the current landscape, how do things look to you?
So in 5 years, we've gone in New York City from one person dies every 8 hours to one person dies every 3 hours. And so it was really important for Biden's administration to recognize harm reduction is legitimate and to actually put money into our field. You can't help but be optimistic about that and hopeful. I have to be hopeful, because if I'm not hopeful, what's it all for? Like, we have to think that we can make change.
On December 16th, the National Institutes of Health announced it would be launching a harm reduction research network. The $36 million network will fund 9 research projects and create 1 coordinating center. The network will be the first of its kind in the United States. For MetroFocus, I'm Christopher Booker.
While the tide may be changing in the way New York is responding to the overdose crisis, for those who have spent decades on the front lines, there is a long way between policy and the street. Christopher Booker has more on that story as part of our ongoing series.
Today in Far Rockaway, Queens, Janie Simmons started with handouts at McDonald's. Her good friend, Robert Keelis, waited outside while she distributed bags filled with the overdose reversing medication, naloxone, and fentanyl test strips. We were asked not to film inside.
These are fentanyl test strips. Are you familiar with those?
Simmons, who is an associate research scientist at New York University, has a special arrangement with the manager here who allows her to connect with the using community who gather in and around the restaurant for privacy. Funded through the city, Simmons started Rockaway Gets Naloxone in 2017. McDonald's is just the first stop. Next is a nearby park.
Right. So if someone's overdosing, if you see someone here in the park that's overdosing.
How long have you been doing this work?
Pretty much 3 decades if we conclude HIV prevention, because I'm primarily an HIV prevention researcher, but I started working in opioid prevention, I don't know, about 2013, I think.
So taking what you knew from your HIV/AIDS work into the world, how different is that?
Well, I think I started working in opioid overdose prevention because I began to recognize that the sense that, opioid overdose deaths were surging, very similarly to the beginning of the AIDS epidemic, and we realized that a lot of people were going to die.
Well, I don't take drugs.
Doesn't matter.
Yeah, I don't take drugs.
It doesn't matter. You still may be in a situation where you're seeing someone who's in.
Yeah, we see everybody.
Harm reduction is all about treating people like human beings. Just treating someone decently like you would anybody else is a kind of intervention. Often a simple engagement, I think, like just offering somebody a tool that can help save their life is really effective.
For Keelis, this approach was born from his own experience. He has been in recovery since 1991.
Harm reduction is not a simple, how can I say, a simple thing to explain to individuals. They just don't understand what it is when you're talking about harm reduction. You know what I mean? Harm reduction to them is like, oh, you want me to stop using. No, I don't want you to do anything you don't want to do. I just want you to use safer. Safer is a way of saying you're reducing your harm.
Was there anything like harm reduction when you were using?
No. Other than the spiritual aspect of it, my family taking me into a church and let them pray over me. That was harm reduction as far as they were concerned. To get the devil out of you, right, so to speak.
What was your drug of choice?
Well, heroin was my drug of choice.
Heroin.
Though I wasn't ashamed to say I used whatever drugs came my way, but if we talk about drugs of choice, it was heroin.
But when you were using, fentanyl was not on the scene, was it?
I don't believe it was. We never heard much of fentanyl. It was always straight up heroin.
Would you want to carry this?
No. Yeah, why not?
He's not doing that. Oh, you want to do that?
Yeah, he does.
I mean, I'll carry it and see if...
But as Keelis points out, his experiences through the early days of the HIV/AIDS crisis illustrate how even with the presence of a known risk like infection or a potentially deadly overdose, it can be difficult to reach users.
They started to give it a name, HIV. And how do you get HIV? Well, we're getting it mainly through injection drug use, right? And we really didn't care. We used. Today it's the same situation. They don't care, they use, right? Knowing that there is a fentanyl maybe in the mix of the product they are buying, they're still using it.
So where does that leave things then?
Well, We think that we have to really improve the message, right? And a way to deliver that message with enough information and enough force to make them realize the danger that's involved right now. You know, dangers that you didn't see back then, but dangers now.
Does the fact that New York now has an office dedicated to harm reduction, does that change your work? Does it help your work?
We'll see. I don't know. This is going to be a process, but sometimes it takes a really long time, and in the meantime, a lot of people die.
While Simmons says she applauds the broader adoption of harm reduction, she worries that the activists, researchers, and users who are instrumental in this moment risk being pushed aside as harm reduction becomes part of the political discourse.
Stay safe. You too.
Thank you.
Take care.
For MetroFocus, I'm Christopher Booker.
If you or someone you know needs help, please call the New York helpline anytime at 8778-HOPE-NY. You can also text 467-369 or visit the New York State Office of Addiction Services and Support's website at oasas.ny.gov.